the Experimental Medicine and Industry Partnership is a new initiative, but really it's aimed to nurture and solidify the collaborations that we already have with industry while growing more interest in this area. We advocate a transdiagnostic approach, which works well with experimental medicine, since underlying biological and psychological mechanisms don't necessarily accord with DSM criteria. And so looking at these kinds of transdiagnostic processes can be very useful when it comes to understanding treatments. And we have experts here on the line across these different kinds of processes and more. We also advocate a cross-discipline approach, not only focusing on pharmacological treatment, but how we can integrate this with psychological treatment, with neurostimulation, and with other types of intervention, including lifestyle interventions. And as part of EMIP, we're putting together a resourced platform and support services, so from our end, that these collaborations can run more effectively. Experimental medicine can allow us to make more effective decisions with more information, for example, about dosing, about targets, which are important for personalisation of treatment. This then can lead to a more informed efficacy RCT design, and it can also form part of the narrative in regulatory submissions. And so I'd like to give you a quick example of an experimental medicine model that we've used for antidepressant drug action in depression. This is just one example though, and in the workshops, I'm sure that you'll get to hear about other kinds of experimental medicine models across different areas, but just to illustrate the way in which this can be used. So this model aimed to integrate psychological processes with pharmacological mechanisms by looking at the effects of antidepressant drug treatments on core psychological processes important in depression, in particular the so-called negative affective bias. This is where patients with depression are more likely to focus on, to interpret, and to remember negative compared to more positive cues or pieces of information, and then this reinforces some of the symptoms seen in depression. It's a target for psychological treatment, but it also turns out to be a target for pharmacological treatment as well. And there's evidence that antidepressants can affect emotional processing very early on in treatment before changes are seen in mood, and therefore may be a useful screen for new treatment development as well. It has the advantage that it can be measured very early on in treatment in a way that's related to later clinical changes in mood. And it also seems to be less susceptible to placebo or demand characteristics than self-report measures. So what do we aim to do with our industry partnership? We'd like to increase the application of these kinds of validated experimental medicine approaches, to collaborate on questions of experimental design, target development, proof of principle, and how to integrate approaches across these different types of intervention. We'd like to learn more about novel treatments, the personalisation of treatments, and other joint challenges. But particularly today, what we want to do is hear from industry. What are the most pressing questions from your perspective, and what can we do? And critically, what do we need to start addressing them? And so this information that we gather today will be really important for us in setting up this industry partnership so that it works for everyone concerned. And so just to add my introduction and welcome, we have over 70 Oxford academics registered to attend the workshops today, with expertise really across a really broad area of expertise, some of which I've listed here. And we also have 16 companies, again, with broad expertise across psychiatry, neurology, technology, experimental medicine, and more. And I'm also delighted that the Medical Research Council, and in particular Adam Babs, who we're going to hear from next, is here today to talk about potential for funding schemes provided by the MRC, particularly to link up this kind of joint working together